President Trump is urging Americans to stay away from each other as the government releases new guidelines aimed at trying to slow the spread of the coronavirus. Those measures drastically affecting U.S. society and the economy.
My administration is recommending that all Americans, including the young and healthy, work to engage in schooling from home when possible, avoid gathering in groups of more than 10 people, avoid discretionary travel, and avoid eating and drinking at bars, restaurants, and public food courts.
Across the country, health officials scrambling to bolster testing as concerns grow that a surge in viral cases could overwhelm the medical system. In Virginia's Hampton Roads, area hospitals are increasing testing and gearing up for a potential influx of patients. Health officials here urging residents to stay home and let the virus run its course.
They don't necessarily need to come to the hospital. Many of these patients will be able to stay home and care for themselves because at this time there is no treatment for COVID-19.
All this as the nation's top infectious disease expert warns they have a 15-day window to slow the spread of the virus. The message from the White House: pay attention to the new guidelines very carefully.
We hope that the people of the United States will take them very seriously because they will fail if people don't adhere to them.
6 counties in the San Francisco Bay Area leading the way, declaring an unprecedented shelter-in-place mandate. 7 million people now ordered to stay home for the next 3 weeks.
We need to anticipate spread, but we also need to prioritize our focus.
In LA County, all bars, restaurants, gyms, and other businesses shut down. Grocery stores, banks, and pharmacies will remain open. It's a similar scene playing out in other states as folks line up outside stores for supplies.
I think it's probably the best thing to do right now, considering that the numbers are spreading.
On Wall Street, the Dow off nearly 3,000 points Monday on fears the virus will cause a recession.
We don't know exactly how pervasive it will be, and we don't yet have an idea of how big an impact it'll have on the economy this quarter, next quarter.
Congress is at work expecting to pass a bill later today aimed at strengthening the social safety nets for those affected by the outbreak. Up next, a bill aimed at bailing out businesses most affected by the shutdown, likely to cost hundreds of billions of dollars. The number of coronavirus cases in the U.S. now passing 4,600 with at least 86 fatalities. Health officials reported 18 deaths on Monday, the largest one-day increase since the onset of the outbreak. George Thomas, CBN News.
George, ladies and gentlemen, I want to point out one thing. This thing is having a devastating effect on the economy. Just think, Fauci said, well, we ought to close down restaurants. Okay, you close down a restaurant, so the restaurant employs 20 people. It's a small business. So those 20 people aren't going to get paychecks because the owner can't afford it. Now, how's he going to pay his taxes? What's got to be done is a massive package from the United States government that opens a facility so that that owner, at least for, say, 3 or 4 months, can get money to keep his business going. Otherwise, millions of small businesses across this nation, affecting the lives of hundreds of millions of people, will be at risk. And we can't allow that. I know the coronavirus is serious, but at the same time, we can't bankrupt people and put a whole lot of people out of work. Just think of one little business, then another little business, and all across the country. These are the ones who hire the most people. So they need to have a facility through the Fed or through the government itself, through the Treasury, which enables those people to, number one, have tax relief, and number two, have enough money that they can have available. And it should be not in terms of loans, it ought to be in terms of direct grants. That's what's got to be done. And yes, it's going to cost a lot of money, but it's going to cost the economy more if these businesses go under. We can't have that happen. Well, CBN medical reporter Laurie Johnson is here to explain the latest developments. And Laurie, healthcare officials are talking about us being at a tipping point. What does that mean?
Pat, basically it means that right now is crunch time. Think of it this way. The United States of America is standing on the edge of a cliff, and what we do in the next 2 weeks could determine whether we go off the cliff or pull ourselves back from it. Jerome Adams, the Surgeon General, who's also on the White House Coronavirus Task Force, said that right now, the next 2 weeks, the United States is at a critical inflection point where we could go one of two ways, like Italy, which is bad, or like South Korea, which is good. Right now, we have the same amount of cases that Italy had 2 weeks ago. In that time, the number of cases in Italy have exploded. And right now, people who are older are being denied care, given their last rites, because their healthcare system can't handle the number of cases. In fact, one study shows that 20% of healthcare workers in Italy have contracted the coronavirus because they don't have enough of these personal protective equipment supplies. On the other hand, South Korea took very, very aggressive mitigation techniques, and it's really, as we say, flattened the curve there. So what we do now, this is our window of opportunity, is going to determine whether we can prevent what happened in Italy from happening here.
Have you got any theory about how long this is going to take? I mean, I know the markets are wondering, is this going to be for months and months or years and years, or is it going to be just a few weeks?
Well, right now is the critical thing. The next 2 weeks is what we really need to be focusing on, and each and every American is being asked to do their part to stay home, if at all possible, and then take other preventive measures. But beyond that 2-week period, there are varying theories. Yesterday, President Trump said this might last until July or August, but clearly the critical point is for the next 2 weeks.
Why again? I mean, this thing is multiplying so fast. If it spreads beyond a point, we won't be able to pull the genie back into the bottle. What do you think the deal is?
That's exactly right. Now, we've talked about how the death rate is 1%, but the number of people who may require hospitalization is as high as 15%. So, we know this is a very contagious disease. They're saying now more contagious than the flu. So we really need to keep these numbers of people who catch it down, because the more people who catch it, the more they will spread it to these people who are at high risk of having complications. And that's what we're really most concerned about, the people who have complications who may require hospitalization. We have all kinds of personnel and beds and supplies for a mild to moderate outbreak, but not for a severe one.
Laurie, thank you so much. Keep us in touch. We want you to come back if you would. Thanks so much, Laurie Johnson.